Okay, let's get started. Welcome, everybody. My name is Adela Mizrachi. I am the communications specialist at IPHAM, and I am really happy to welcome Judith Moskowitz for today's IPHAM webinar. Judy is a professor of medical social sciences at Feinberg. She's also the director of research at the Osher Center for Integrative Medicine at Northwestern Medicine. And she's the director of the Behavioral, Social, and Implementation Sciences Core at the Third Coast Center for AIDS Research. Judy is a social health psychologist who conducts patient-oriented research regarding behavioral and psychosocial factors in the context of significant illness or other life stress. Her current research is focused on the adaptive role of positive emotion regulation for support of beneficial health behavior, such as diet and physical activity, and prevention of maladaptive health behaviors, such as substance abuse. Judy came to Northwestern 6 years ago from UCSF. I am very excited to hear her presentation, but before we begin, I do want to let you know that if you have questions, I am going to rename myself Q&A, so you can privately message the Q&A host in the participants tab, and I will collect them and ask Judy those questions at the very end. Welcome, Judy.
Great. Thank you. Thanks, Adela. I appreciate the invitation. Welcome, everyone. I hope you're all staying safe and healthy in these unprecedented times. Which is the way we have to start every interaction these days.
Wait. Judy, can I interrupt you for a second? I think you're muted. Oh, shoot.
Oh, there we go. Well, that's better. Can you hear me now?
Sorry. Yes.
So what I was saying was, for those of you who aren't lip readers, I was saying that, it might seem strange for us to be talking about positive emotion when we're experiencing such an unprecedented stressor. So, why would we be talking about positive emotions when feelings like fear and anxiety and helplessness and distress are predominant? The title of the talk is, Can Positive Emotion Interventions Help for Coping with the Stress of a Global Pandemic? And, if you're here just for the bottom line, the answer is yes. So you can, log off and go do something else now if you want. If you're interested in hearing more and why I'm so confident that the answer is yes to that question, stick around. So I've been studying positive emotion in the midst of stress for about 25 years now. This work started back when I was a postdoc at UCSF, and we were studying men caring for their partners with AIDS. So this was the early 1990s. It was before there were effective treatments for AIDS. So it was essentially a terminal illness. So the question going into that study was, how are these men coping with the pretty extreme stress of providing care for someone with AIDS, and then coping with the death of that partner as well, because in most cases, AIDS was terminal. And so the caregivers in our study were not only coping with caregiving, but also coping with bereavement. And we were very focused on what was stressful about the situation and how they were coping with it. So initially in the study, the participants would, they came in every other month for up to 5 years. and did these extensive interviews. And initially, we were ending the interview with what's called the stress and coping portion. So participants were asked to talk about something that was stressful for them in the past week related to either the caregiving or if their partner had died related to bereavement. So the caregivers told us what was stressful, and then we handed them the ways of coping checklist. And we said, how did you cope with it? And then they would list off how they coped with it. And then that was the end of the interview. And pretty shortly after the start of the study, the participants were like, yeah, this is hard and this is stressful, but you're not asking us about the good things that are happening, which was a surprise as we were going into this with very much a stress and coping framework. And they were experiencing some of the most extreme stress you can imagine. But we listened to the participants and added a question to the end of the interview that where we said, can you tell us something positive and meaningful that happened in the past week that helped you get through a day? And in almost every single interview, the participants could come up with something positive that helped them get through a day, even if their partner had just died. We brought them back in for interviews within about 2 weeks of the death of the partner, so really at an extreme low point. But even in that context, they were able to talk about something good that had happened. So that was one of my first clues that positive emotion actually occurred in the context of significant life stress, and that maybe it was actually helping people get through. And around this time, there were also some other studies coming out showing that people had this, what we called co-occurrence of positive and negative. So when they were under stress, they definitely had negative emotions, but there was also the possibility for positive emotions. If the researcher thought to measure it, you would find that people reported positive emotion as well. So what? Maybe it doesn't matter. Maybe, you know, that if happy and grumpy occur together, does it do anything? Well, it does. I always like to start by showing you some of the research that shows that people who have more positive emotion live longer, independent of their negative emotion. One of my favorite studies to show this is the nun study. The original hypotheses, or the original goal of the nun study, was to look at cognitive decline or cognitive function in later life. And then after the nuns died, they autopsied their brain and looked for brain changes and relating that back to their cognitive decline. But the researchers also had access to a huge sort of treasure trove of data, treasure trove if you're a researcher. And one of the pieces of data they had were these autobiographies that the nuns wrote when they were entering the convent. So they were like 19, 20 years old, and they were asked to write just a page on their life so far, why they wanted to be a nun, why they were coming to the convent at this point. And the researchers analyzed those narratives for positive and negative emotional content. So they counted up, you know, the positive words and the negative words, and they also looked at something called lexical complexity, which is a proxy for IQ, which also predicts longevity. And then they related the proportion of positive words to length of life and for survival. And what they found was that the nuns who had the highest proportion of positive emotion words in their narratives at the age of 20 were much more likely to be alive out at age, you know, here's age 90 and older. So these are the two highest proportion groups for positive emotion. And this, again, is controlling for negative emotion. It's controlling for that lexical complexity. So it's controlling for a number of things that predict longevity normally. So there's something about positive emotion, you know, certainly expressed early in life, earlier in their lives, that is related to longevity. Other studies that have looked at more proximal associations between positive emotion and longevity, like asking people their positive and negative emotional experiences over the course of a day, that's actually been shown to be related to longevity over the next 5 years. So it's not simply that these women were positive at age 19 and they remained dispositionally positive, which helped them live longer. There's also evidence to show that it's your emotional experience that is actually related to longer life. Positive emotion is also related to better health behaviors. So people with more positive emotion have better diets. They're more likely to be physically active, and they're more likely to be adherent to their health provider's recommendations. So more likely to take their medications, for example. And this, the health behaviors are thought to mediate the effect of positive affect or positive emotion on mortality. So here's a study that was published in 2013 that showed that when you look just at positive affect or positive emotion, it predicted lower risk of mortality over time. And then when you added physical activity into the model as a mediator, it turned out that that was where the money was, so to speak. So more positive emotion, more physical activity, and lower risk of mortality. We had a study of people newly diagnosed with HIV where we showed that people who had more positive emotion at baseline when they entered the study, which was about 8 weeks post HIV diagnosis, the folks who had more positive emotion were more likely to be engaged in care at a 3-month follow-up. So again, more positive emotion, more likely to be adhering to health recommendations. So about from like 12 years now, I was looking at the data showing that, you know, the sort of the natural occurrence of positive emotion helped people cope with stress. It was related to better health. We had some work showing that it was related to longevity in people living with HIV or type 2 diabetes. So, you know, I knew a few things based on the data. First, I knew that positive emotion co-occurs with negative emotion in the context of stress and is responsive to the context. So again, it's not just that people are dispositionally positive and that remains stable no matter what's going on. You definitely see emotion, or positive emotion and negative, you know, dipping up and down according to what's going on in their lives. So the caregivers around the time their partner died, their positive emotion definitely took a drop, a significant drop. So it's not simply that it's just a dispositional thing. So it is, positive emotion is responsive to the context. And we knew that it has independent beneficial effects, so independent of negative emotion. And it was pretty clear that someone should design an intervention to help people have more positive emotion so that they can cope better with whatever type of life stress they're experiencing. Now, I'm a social psychologist. I'm not a clinician. So I'm pretty uncomfortable sort of, you know, messing with people or, you know, telling them what to do. Much more comfortable with observational studies. But it was clear to me that this was the next step to really show that there might be a causal link between increased positive emotion and these beneficial outcomes. So I did go to the literature to look for habits or behaviors or skills, things that people could do to increase their own experience of positive emotion, things that they could do, make a habit. You know, there were some programs out there that were things like, you know, we know that if you send people an unexpected gift, they have an increase in positive emotion and that has some beneficial impact, but that's not a sustainable program. You can't send people gifts forever and then hope that that will last. You can also, you know, show people pictures of puppies and kittens, or movie clips is a commonly used mood manipulation in social psychology. But again, that I wanted something that people could use as sort of a toolkit, things that they could go to increase their positive emotion. So the first 8 things, bullet points here, were part of the original program. We have since tailored the program for different samples, and sometimes we'll swap out some of the original 8 and do behavioral activation or self-compassion or emotion literacy in addition or instead of some of those 8. But the top 8 are, those were the originals. I'm not going to go into a lot of detail on these, but one that I'll talk about just a little bit is noticing positive events and capitalizing. I've been getting a lot of questions from, the press asking, what can people do to cope? Are there things they can do? And one of the ones that I think is really easy to teach people is sort of noticing positive events. And it's challenging when things are really stressful and really hard, because humans have evolved to pay attention to the negative stuff, right? That's adaptive. We need to focus on what's going wrong and cut out the noise at the sides, and really so we can do something about what's going wrong. The problem with that is that you tend to then neglect the positive things that are happening that can actually sort of help sustain you through this period. So one easy thing you can do is sort of just take a moment each day and notice something positive. So many of you are in the Chicago area, and you know that we have had a lot of rain and a lot of clouds, and today it is sunny out, and that is huge. So that is the positive event that comes to me right off the bat. Related to that is capitalizing. We also call this savoring. And that's telling someone about your positive event, or putting it on social media, or putting it in your journal, or just noting it in your head. It gives you a chance to sort of re-experience the positive emotion that you get from that positive event. So the little side note. So we've put together this program of these skills that we teach people experiencing various types of stress. This is our theoretical model and how we think about how this works. PPI is a positive psychological intervention. So our program falls under that umbrella of a positive psychological intervention. So we hypothesize that engaging in the PPI increases your positive affect, or your positive emotion, sort of in the short term. And that this has a number of proximal effects, one of which is giving you a break from the stress, sort of a timeout. You take a moment to experience this positive emotion. It helps give you even a moment of respite. Through these proximal effects, then there's the possibility of improved sort of physical function. So mostly through a blunted stress response. Also improved health behaviors. So if you're able to increase your positive affect, you're more likely to take better care of yourself, as I noticed before. And then through these longer term, you're going to have better physical health and psychological well-being. Okay. So one fun thing about our lab is that we name all our studies using plant and flower acronyms. So on this slide, you'll see cedars, lilac, lavender, dahlia, orchid, larkspur, marigold, daisy, iris, leaf. Laurel is down in the left-hand corner. Artemis is also there. That is not a plant or a flower to my knowledge, but it is part of a program of research of one of my mentees, Adam Carrico at the University of Miami, and I let him name his own studies. So what we've done is the original study that we did of this, this intervention, this program, was called IRIS, which stands for Intervention for Those Recently Informed of Their Seropositive Status. So we recruited people who were newly diagnosed with HIV and randomly assigned them to learn these skills or to do attention control activities. So that was the original. And since then, we have tested the intervention in a number of different groups, many of them listed here. People with bipolar disorder, high school students. We've recently done a pilot here at Lurie in pediatric heart transplant patients. All of these on this slide were in-person delivered, either by a facilitator one-on-one or in a group setting. We have also translated the program to be online and self-guided. So through about 5 weeks, you learn about the skills and are able to practice them. I'm going to talk a little bit about the Marigold study in just a minute. And then this slide is sort of the hybrid ones. LEAF was delivered via the internet, but by tablet. So it was a live facilitator, but remote facilitated. And I'll talk about that first. So the LEAF study, LEAF stands for Life Enhancing Activities for Family Caregivers. It is not my best acronym. So this was a randomized trial of 170 informal, so basically mostly family caregivers of people with various types of dementia across the United States. We compared the intervention to a waitlist emotion reporting control. So during the initial period when before they crossed over to get the intervention, the control group was doing daily emotion reporting. The intervention itself was delivered by a facilitator via these tablets that I'll show you in a second. This was funded by the National Institute of Nursing Research, and my co-PI on this is Glenna Dowling, who's in nursing at UCSF. So the program was delivered. It took approximately an hour a week, one-on-one with, live with the facilitator for 6 weeks. The tablet, this is a picture of the tablet, and Erin, who was one of the facilitators. And we taught the 8 skills that I listed, those first 8 bullet points. And then, you would learn about 1 or 2 usually of the skills a week. And then we also gave participants this really nice booklet where they could practice the skills, sort of do daily home practice to sort of try out each one and see how it worked for them. The caregivers were about 63 years old, mostly female, mostly white. There was some mix of urban, suburban, rural. Retention was really good. Certainly compared to some of the other studies I've done, we can talk about why that is, but it makes me want to just study caregivers from now on. Caregivers came from all over the United States. And here's the design. So they did the baseline assessment, and then they were randomized to either the LEAF skills, which they practiced for about 6 weeks, where the facilitator, did we used WebEx for this study, called them on WebEx and walked them through the skill, and then they practiced it. Or the control group did daily emotion reporting for 6 weeks. And everybody did another assessment. And then the control group crossed over and learned the skills. So everybody in the study eventually got to learn the LEAF skills. Here's one way to look at our findings. This is a graph of the effect size for the difference in change from baseline to post, comparing the intervention group to the control group. So this first bar shows that the intervention group increased significantly more than the control group on the differential emotion scale. This is the positive emotion measure that we use, and that's a pretty healthy effect size. We also got significant effects on depression. So the intervention group dropped more on depression and increased more on positive aspects of caregiving. Negative emotion, caregiving burden, and perceived stress were all in the right direction, but did not reach statistical significance. So when you drill down a little bit more to look at what was actually happening, for positive emotion, this green line, these are the caregivers, the intervention group. So they basically held steady, maybe with a slight increase in their positive emotion. And the emotion reporting control group actually had a drop in their positive emotion that they then, recovered when they received the skills, which is what happens here. Okay, so it wasn't as much that the intervention group was having this huge increase in positive emotion compared to the control. It was actually the control group was dropping in positive emotion. We don't actually think that's because they were reporting their emotions, which is one possible explanation. I think it's more that objectively, the situation was getting worse for most of these caregivers. Their care recipient was getting sicker and needed more help and there was more caregiving burden. So we think that's actually what was going on here and why their positive emotion was decreasing. When you look at positive aspects of caregiving, you see that the intervention group, the group that got it initially, had this nice increase in noticing the positive aspects of caregiving, which is sort of a nice manipulation check for us. And the control group stayed stable in positive aspects of the caregiving, but then when they learned the skills, they had a nice increase. And depression is sort of the mirror image. So the intervention group had a big drop in depression when they were learning the skills. The control group also dropped in depression somewhat during this first period, but then really had sort of this parallel drop in depression when they learned the skills. Okay, and if you think back to the graph that I showed you where we hypothesized that changes in positive affect or positive emotion was actually a mediator of psychological well-being down the line. So we were able to test that in this study, and we're able to show that certainly those in the LEAF condition or in the intervention had a decrease in depression, and it appeared to be because they had stable positive affect over time. So it was that the intervention impacted emotion, positive emotion, which then led to decreases in depression. Okay. So I want to tell you about one of our online self-guided interventions. So, I mean, you know, facilitated interventions are great. They're quite effective, but they're hard to disseminate and they're expensive. So we designed an online self-guided version of the intervention. This one is one of my better acronyms. Was funded by the National Institute of Mental Health, and it's an R34, so it's an intervention development grant. And what we were primarily trying to do in this grant was improve the adherence to the self-guided intervention. If you know the literature on self-guided, you know, online interventions for people with depression in particular, adherence and retention is pretty bad, like less than 50% in many cases. So what we were trying to do was design enhancements that would improve that stickiness of the intervention so that people would want to come back. So we were comparing facilitator contact, that's what FC is, an online discussion board, and virtual badges. And this is indeed a 9-arm trial where participants either had the intervention only, they had a control condition only and didn't get the intervention, or they got 1, 2, or all 3 of the enhancements. I'm not actually going to talk about those findings so much as talk about the effect of intervention versus control. So the findings I'm going to show you are the 539 participants who got the intervention with any enhancement or none, any intervention at all, compared to the emotion control who did not, participants who did not learn the intervention. Okay. This is slightly different from the 8 skills taught in LEAF in that we swapped out attainable goals for behavioral activation. We swapped behavioral activation in. And, you know, it's similar in the sense that the goal of behavioral activation is to encourage participants to do anything, like even a small activity, which can help sort of break them out of this sort of downward spiral and can help with the sort of motivational deficits that come with depression. The participants were, again, you know, all recruited online. They ranged in age from 18 to 80. They had to have a PHQ, which is a depression screener of 5 or above. So they had to be experiencing some depressive symptoms. They had to have daily internet access. They had to have a phone where they could receive text messages for some of the assessments we were doing. They needed to live in the United States and be able to speak and read English. The intervention content was delivered, as I mentioned before, in these sort of weekly modules where they learned a skill or 2. We had 5 weeks of content, and then each week a new lesson was unlocked. So they couldn't power through all the content, you know, in a single sitting. We really tried to sort of meter it so that they would learn a skill and then have time to practice it and sort of try it on. All completed through a website. So assessments were at baseline, pre-randomization, then post, which was about 6 to 8 weeks later, and then 1 month after that and 3 months after that. So, this is what depression looked like. The intervention group had a significant drop in depression, and it was greater than the drop for the control condition. Again, the control was doing this daily emotion reporting. Positive emotions, when we asked people over the past week, how often did you feel? And we give them a list of emotions. There really wasn't a difference on positive emotion. There's a little bit sort of peeking through within time point here, but it's not significant overall. Luckily, we had been moving toward looking at other ways to measure emotion, because asking people over the past week, how often did you feel a particular emotion? That's not our main target. Our main target is, today or yesterday, how often did you feel these emotions? So we're really trying to increase positive emotion on a daily basis. And in particular, we're interested in helping people maintain their positive emotion in the midst of stress. So through this daily inventory of stressful events, we're able to measure, and this is an end of day assessment that they did in bursts at each assessment point, where they reported a series of stressful events, if they experienced them and how stressful they were. And then they also reported their emotions over that past day. So this is what it looks like in one of our current studies. So in the past 24 hours, have you had an argument or disagreement with someone? If it didn't happen, you say it didn't happen. Maybe it happened, but it wasn't stressful, up to it happened and it was very stressful. So there's a series of sort of global stressful events that they can respond to. And then there's also an other option. So they can, if there was something else that we're not capturing with these items, they can respond to a different stressor. And then we ask them a series of positive and negative emotions. And how much did you feel this over the past 24 hours? Okay. So when we look at days where they report no stress, you don't see a difference between the two groups. Everybody's sort of increasing in their daily positive emotion equally. But when you look at stressful days, we see that participants who had learned the skills, who engaged in the Marigold intervention, had higher levels. They were able to maintain their positive emotion even on a day when they experienced stress. And sort of even more exciting to me anyway, is that this change in positive emotion, this increase in positive emotion on days with stress that the intervention group was experiencing, that mediated the effect of the intervention on depression. So we're seeing some support for our theoretical model that it's daily emotion in the face of stress that is sort of the key ingredient here. Okay, so maybe why you're here to hear about whether we can use these positive emotion skills for coping with a global pandemic. My whole frame for all of this work is that these positive emotion skills can help you cope with whatever you have to cope with. So my answer to whether positive emotions can help you cope with the stress of a global pandemic, as unprecedented as it is, the answer is yes, they can. There's very little in the literature about stress of global pandemic. There was a SARS outbreak a number of years ago, some of you may remember, and there is a study out there of people in, this was in Toronto, who were quarantined because they'd had exposure to someone with SARS. And one of the questions they were asked was, how did you feel during quarantine? There's no, I can't get any more detail on how they asked it. Was this, you know, just they could pick one thing? Did they offer these? I didn't get any sense of how it was assessed. But note that happiness and relief were reported. So there's some evidence that even in the midst of quarantine, that people also experience positive emotions, or they at least will report them. So when we talk about our program of skills, we do think that these can help. So we have actually made it available for people in a sort of a generic version, made it available online. So people can try these skills out and see if they're helpful for you. The study's called Positive Affect Regulation Skills. Again, not my best acronym, but now that I'm going down this road of plants and flowers and botanicals, I'm sticking with it. The homepage, your sort of dashboard looks like this, where here's where the homework or the home practice is. This is your daily emotion check-in, which is always part of our program anyway, that you report your emotions every day. You click on this button, you'll get the skills that are available to you at that point. You can go right to home practice. You can look at previous home practices if you want. There is a discussion board where you can discuss the skills. And then there's also an awards page where you get virtual badges for doing things like logging in for 7 days in a row, for example. So this is what the skills page look like. The skills that are open to you at that point will show up. And then you click on this and it just walks you through. It's pretty basic, but it sort of walks you through each of the skills, why they work, and helps you practice it a little bit. Here's the link. I'll show this to you again later if you wanna try it out. And then we can actually answer the question of whether positive emotion skills can help in coping with the global pandemic. So I wanna just offer a few caveats here that are really important. If you don't know, this is Pollyanna. She's the one who's always looking on the bright side. This is not Pollyanna. This is not just pretending like things aren't bad and things aren't hard. I think it's pretty safe to say that life right now is hard for everyone, particularly for people who are sort of on the front lines, you know, healthcare providers, essential workers, people who've been sick, people who've had loved ones sick, people who've had loved ones die. Even for those of us who haven't been quite as directly impacted, there's so much, you know, uncertainty. It is stressful to have to stay in your home. It is stressful to have to think about every interaction with another human being potentially an infection. You know, I'm looking forward to the day where I can walk past a stranger on the street and not get like a surge of cortisol thinking, you know, oh, they're too close, right? I think, you know, and we don't know when things will go back to normal. So this is going to be with us for a while. It would be kind of strange to not experience negative emotions in this context. My point and the point of our research is that positive emotions are certainly possible, and that what these skills can do is help you experience positive emotion alongside the negative emotions that are very natural and normal and pretty expected in this situation. So, you know, I sort of, you know, roll my eyes every time I see another, you know, 10 tips for happiness, right? Because that's not what this is. These are, I really think of these as coping skills and ways you can have more positive emotion alongside the very normal feelings of stress. Okay. I need to thank the folks in my lab, Elaine Chung, Liz Addington, Veronica Grody, Sarah Bassett, Amanda Summers, Ian Kwok. Here's what we look like in real life. And now we have time for some questions.
Thanks so much, Judy. I personally found this really fascinating. I know it's really top of everybody's mind right now during these really difficult times.
Mm-hmm.
Again, if anybody has any questions, just shoot a chat message to the Q&A, and I will go ahead and ask Judy. So far, I have one. It's from Abby.
Mm-hmm.
She says, although positive and negative emotions have found to not be a disposition in your research, how have you seen natural disposition play a role in one's experience of positive emotions?
Right. So I think these skills come more easily to some than others. Yeah, there is no question. I think, there are people who are sort of dispositionally positive and they just look on the bright side naturally. And in fact, that's, our early work in this area came from people who were sort of naturally experiencing more positive emotion and wanted to talk about it. So there certainly are sort of dispositions toward being more positive or negative. There are also, when we work with participants and teach them these skills, we get sort of the range between that's completely stupid, I would never do that, versus, oh, I already do that, right? Oh yeah, I'm totally like that. So what we do is say, for those who say it's completely stupid and that would never work, we say, just, give it a try. We're testing it out. Just try it for a week, see how it feels. And then for the people who say, I already do that, like that's my natural thing, we say, great, you'll be really good at this. We ask you just to practice it for a week intentionally and see how it feels for you. We're also going to teach you some other skills that might be a better fit or be an additional tool for you to try. So there's absolutely dispositional, positive and negative, sort of as part of your personality. But we can also move that around with these skills, which is what we try to show in our work.
Oh, I'm sorry.
That's right.
Myself. So I'm asking, another question is from Constance. She's asking, do you have a current study going on regarding COVID-19?
Yes. So this PARC study that I should still be on your screen is, the skills themselves are presented as, general coping with whatever you have to cope with, which is how we think of the skills anyway. We do have a few questions as part of that study about sort of your, exposure, as it will, either, psychological exposure or physical exposure to COVID. How much you are consuming media about COVID and sort of your how much you're thinking about it. So we will look at that and see if be able to look at how stressful people are finding COVID specifically, and whether these skills can help them. But the skills themselves are not COVID specific or coping with COVID specific.
Okay, thank you. We have another, sorry, I'm trying to manage all these.
Yeah, I know it's
influx now. Regina's asking, have you personally used these skills?
Yes, all the time, but maybe not as much as you would think. Before COVID, I'm just going to go back to the list so you can look at those as we're talking. Sorry. There we go. Before COVID, my go-to was positive reappraisal. So, and that is being able to see either something good that can come out of the situation, or how it could have been worse, or maybe something you've learned. That was always my go-to. I can positively reappraise any stressor, literally. Now with sort of the shelter at home, or dealing with the fear and uncertainty of the coronavirus, I have found myself relying much more on self-compassion, which you see down toward the bottom, which is, you know, this is not the best description, but it's basically cutting yourself some slack. So I think many of us who are, you know, academics, I'm not a clinician, I'm not in the clinic. So my job is basically to do this, to sit in front of my computer and, you know, analyze data and read things and write grants and write papers. So you would think that, you know, eliminating my commute and maybe cutting down on some meetings, I could, you know, I'd write a book, or I would, you know, get lots of papers out, or, you know, I spend probably half my day managing anxiety, basically. So I really try to focus on self-compassion and, you know, this is hard for everyone. Cut yourself some slack, do what you can, you're doing great. So that's sort of talking to myself as if I would talk to a friend who was sort of beating themselves up for the same reason.
Great. Okay, from Barb, how do you feel that this is different than quote unquote stress management and the benefits of this positive approach?
It's totally stress management. It's another form of stress management. So you know, there are lots of different types of stress management. Mindfulness is listed here. That is often used as a form of stress management, sort of mindfulness meditation. Cognitive behavioral stress management has some overlap with this. Positive reappraisal in particular is in both of those. So, you know, when I put these skills together originally, I wasn't thinking I'm going to come up with something completely different and new. That wasn't ever the goal, and wouldn't be possible anyway. Instead, we really looked for things that had been shown, you know, individually to increase positive emotion. So sometimes they also reduce stress, they also reduce negative emotion, but if they'd shown an effect on positive emotion, I put them in the program. So I think this is different from some other types of stress management programs in that, you know, we're really focused on these skills that can increase positive emotion specifically. It's also different than some in that we're offering this sort of buffet approach. And, you know, I'm not saying you need to do all of these things. They're synergistically interactive to increase your happiness. That's, you know, that's not what it is. Instead, it's here are a number of skills that if you practice them, it has been shown that it can increase your positive emotions. So try them out, see what works for you, and then do that one, or do those 2 or 3, whatever works for you, and whichever ones you can make a habit, those are the ones you should continue doing. So I think, you know, that in that sense, our focus is a little different than stress management, which really focuses on reducing stress only.
Great, thanks. So another question, you have looked at a number of special populations. What about the general population?
I'm sorry, what, you cut out what population?
She asks, you have looked at a number of special populations. What about the general population? The
general population, right. So it's really interesting. So we've looked at special populations, you know, zeroed in on and focused on specific populations, primarily because that is how the National Institute of Health is structured. So, you know, we're looking at populations that are of interest to the different institutes, so we can get funded to do it. And you know, our first study was in people with HIV, and I try to make the point that this is not HIV specific, just because, you know, we first learned about this in people living with HIV and first demonstrated some efficacy in people living with HIV. It doesn't mean that these skills will only work for people living with HIV. It's really a broader umbrella that these skills work for whatever kind of stress you're coping with. And everyone is coping with some kind of stress, even if it's just daily hassles type of stress. So in terms of the general population, this should work. I have no doubt.
Great. Okay. I wanted to know how you see adapting these skills to nursing home populations and older isolated adults in general, given that this pandemic has heavily affected those who are most vulnerable to COVID. And she specifies that when she says adapting, she means as in the delivery. Right.
So adapting the delivery for nursing home residents or caregivers? I'm assuming it's residents.
I think so, yeah.
Yeah. I think the adapting so the skills would be basically the same. You know, there might be some adapting for, you know, any cognitive differences. I've had some discussions of people saying, well, you know, we should try these in people with Alzheimer's. And I'm like, or other dementias. I'm like, well, you know, if they've got the cognitive ability to engage in the skills, you know, at sort of a minimal level, yes, that could work. But so with that sort of caveat of, you know, if they have the cognitive ability to engage in it, the main adaptation would have to be, how do we get to them? So, you know, it's not like right now, it's not going to be doing it in person. We're not going to be sending facilitators in. So it would be either remote delivery live with a facilitator like we're doing like we did in the LEAF study, or self-guided online if they had that kind of access as well. Those would be the main changes I would make. I'm looking at the list. Yeah, I think these could be easily taught to an older sort of nursing home population, assuming you know, acceptable levels of cognitive ability.
Right. Okay, a question from Megan. Thanks for this is Megan McHugh. She says, hi Judy, thanks for a very interesting and timely presentation. Hi Megan. Can we teach these skills to children? And if so, are there good that you would recommend?
So the youngest age we've taught them to is in the CEDARS program, and that is that was 11th graders or adolescents. I'm working with some folks right now. Hi Nia Hurd-Garris, to adapt the program for adolescents adolescents who've experienced adverse childhood experiences. So that work is in progress. In terms of teaching younger skills, so actually in the pediatric heart transplant study, we did have a version of it, or we do have a version of it that maybe down to age 8 or so, we, you know, try to make the skills sort of understandable and the practice, the home practice understandable at that level. I think more generally though, a lot of these skills are transmitted from parent to child through modeling. You know, if you're expressive and open about your own emotional experiences and how you're coping with it, I think you can help kids learn it. There are some really great resources on the Greater Good Science Center has really good sort of parenting and positive emotion skills resources, a lot of good suggestions, you know, things like at dinner each night, talk about one good thing that happened. So there are lots of things out there that sort of get at these same skills, sort of with the appropriate sort of age, literacy and understanding levels.
Great. We have a lot of questions, but we're running out of time, so we'll get through as many as we can. We have a question. Have you noticed these positive psychology interventions demonstrate sustained improvements and measured outcomes, or does it plateau / taper off at a certain point?
We don't know yet. For our studies, we actually have in at least one of the trials seen an increase in effect. And this was in the study of people newly diagnosed with HIV, where the control group was personal interviews, which, you know, actually improved people's well-being somewhat as well. The positive emotion skills were more effective. But once the session stopped, the positive emotion skills group continued to either maintain their well-being or continued to improve more, whereas the control group was no longer getting that attention, so they sort of dropped off. So we actually saw an increase in the effect size over time, which is kind of unusual. And again, we haven't done really long-term, like years later, are people still doing it? Anecdotally, we hear people say that they're helpful. One of the LEAF study participants, one of the dementia caregivers, let us know that after her husband died, and I actually heard this secondhand, she had told this to a reporter who was interviewing me again, and after her husband died, she used the skills again, and they were really helpful for her. So I think for people who are able to make them a habit and sort of, again, put them in their toolbox and carry them around to cope with whatever they have to cope with, they can be, have a sustained effect. But, you know, it's like physical activity. You have to keep doing it. You can't just do it for 6 weeks and then be done and never have to do it again. These are things that you have to take up as a habit.
Okay, so do you find that some skills are more important than others? What I mean is, are there some that are more effective than others, or do the skills just depend on the person?
I think they depend on the person. We are actually doing a study right now where we're doing a MOST design, for those of you who are familiar with that, where we will test, actually we're testing the weeks against each other. So it's like noticing positive events, capitalizing, and gratitude are grouped together. Mindfulness is on its own. Positive reappraisal, it's on its own. So people will be assigned to, you know, 1 to 5 weeks of the skills versus inert content. So we'll be able to tease apart, in theory, which skills are most powerful. This was not a study that I was ever that excited about doing, but my my co-PI on it, John Salzman, who used to be at Northwestern and is now at Wake Forest, really wanted to tease the skills apart. So I was like, well, we can try it and see. My hypothesis is that it's very individual, and the skill that works best for you is the one that you'll do. So to be continued.
Well, I think it's 1 o'clock exactly, so I want to be cognizant of everybody's time. We got a lot of thank you messages for your presentation. We got somebody saying, thank you for your honesty. It's so refreshing. Thank you for your contribution. It's especially meaningful during this painful period, and it can help so many families who are experiencing tension and increased domestic violence. And we need to get more people to become aware of your helpful program. So those are just a couple of the comments that came through.
Great, thank you.
Yeah, thank you, Judy. It was really fascinating. I will be posting the recording on the IPHAM site. I will also email it to everybody who registered, so you can, you know, go back and look and reach out to Judy if you have questions. Thanks, everybody.
Thank you.